And who has graced our presence this morning is Mr. Hospital Administrator himself, Mr. Kasey Lucas.
Good morning.
How are you?
Good morning. Good.
You're looking good, man.
Thank you.
You know, the holidays haven't wore you down yet?
Not well.
Yet.
There's lots going
I
on.
said
so,
yet. Yeah.
Yeah.
A lot of stuff going on, yeah. It is a different time. There's no doubt about that. And we're going to address a little bit of that as we're talking this morning. But I want to thank Kasey for coming in. This is a busy time of the year, and I know you've got kids and you got a wife. Don't forget about Hope. You know, you're going to get in trouble if you forget about her. So you don't want to do that. So we want to make sure that Kasey's on top of it all. But, you know, there's just so many different things going on. And right now the hospital, as you're mentioning to us right before we came on the air, on your Facebook page, you have a one-question survey about vaccines.
Yes.
You know, so
yes.
you would really appreciate getting some feedback on that from people. They would go to the SMDH Facebook page and take the one-question survey.
Yep. It's linked to a SurveyMonkey survey, and we are an approved vaccination site or vaccinator, and so we are wanting to prepare and make sure that we have plenty of those vaccines, and we are going to be getting the Moderna as soon as that approval is, and I don't know, I think they're looking today or tomorrow.
I think it's through a committee today, and they think it can be approved by tomorrow.
Yeah, so we're hoping that that comes through, and then we are looking for, we are still preparing ourselves, so we're trying to gather all of the facts, all of side effects and indications of when you can take it and when you can't take it, and putting all those things together, really getting ready for to give that, and really looking for that verification or that consent. And you have to know all those things for that consent. So again, just trying to get prepared and get ready to bring that as soon as possible. I know that the Show Me Vax website that we use to set all these things up. I mean, they look at everything, storage of these vaccinations, and make sure that you can store them for, you know, I think the Moderna, we can end up storing those for about 30 days. So,
not the case with the Pfizer one. That's what, 1 week?
Right. Yeah. They have to be given within 10 days, and so, yeah, we can't do that.
Takes that long to get here.
Yeah.
Much less to get it.
I know that once it got to Missouri or was in Missouri, that the State Highway Patrol was going to help deliver those. So, looking at that. So
try and get it as quickly as possible. Yeah, got to be kept at such a cold temperature. It's, you know, and it loses its potency.
Yeah.
We don't want anybody to go through all this and then not have a shot that's going to do any good.
Yeah,
you know, that's kind of crazy.
Yeah.
But it's definitely a different time out there. And in case we all know that, you know, we've all gone through this now with this vaccination coming out. And just remember, it's not going to be here tomorrow.
No.
It's going to still be a little while. And we're in a smaller town, so we're not even on the top priority list yet. They still got St. Louis, Columbia, Springfield, Kansas City. They're all on the higher priority list. But one thing we don't want to remind don't want people forget, not remind them, don't forget that you still need to get your flu shot.
Yes, definitely.
I mean, it's not like we're out of the woods, so we don't have anything to worry about. We do. We got a flu, and it can tear you up pretty good too. We just don't want anybody to get sick for any reason. But
and we have plenty of flu shots.
Yeah.
So
get them, take them, get them done now, especially if you're going to be traveling anywhere for the holidays. Get that flu shot now, and it takes about a week or so to take effect. So, want to make sure people get that done. All right. Well, we had a board meeting on Tuesday, and it'll be the final board meeting of 2020. I didn't see anybody, popping any champagne corks to get rid of this crazy year.
Yeah.
But
we should.
We should. Absolutely. And it's been a trying year more than, just the normal ways of dollars and cents because of COVID. Everything changed in March. We all know that. typically just going to the doctor, showing up at the clinic and your treatment, not a big deal. Now you got to have your temperature checked. You got to get this done. You got to get that done. Check in at this office. You got a lot of different things have changed at the hospital, all for protection. But I don't think anybody anticipated the long-term effect of this.
Oh no, definitely. You know, when I'm going to say back in April, May timeframe, and you know, all of these different CARES Act funding start to appear, start to come out, programs, you know, the PPP and all of those things, and you know, you at that time, oh well, you know, if it lasts through the summer, you know, we'll get to fall, and then things will
back to normal.
It'll be back to normal again. You know, you start thinking about the flu and flu season and that coming along, and then you get to that point, and now we've got this issue of when we're testing. Now we're testing for flu and COVID, and you know, which one is it? Because if you know the symptoms are very similar, then you know you want to make sure that we give the proper treatment and we identify it correctly. And so you start this testing, and we have received some rapid testing, and there's different types of testing that you can do, and so some more reliable than others. And so as you start to do that, we still have equipment. We still have COVID testing equipment on order. We're hoping early January to receive that, and then you know we have to do some quality checking and making sure it's set up and ready to go, and then we will be able to do more rapid testing for COVID. And so it'll be a dual COVID flu. I mean, we can do that today, and so it will be something that, again, it'll be handy. It'll be a quick turnaround time. It won't be 48 hours. It won't be, you know, it'll be
keeping people in limbo.
It'll be an hour. Yeah, it'll be hour turnaround time compared to everything else.
Because you didn't know. I remember when I got my test, and even though I was in the hospital, you still don't know.
Yeah.
They're treating you like you have COVID. Maybe you didn't.
Yes.
You know, but they couldn't take the chance. So
Nope.
you have to dress up in the, I always kind of call it the military garb. You know, radiation factor. You almost feel like you're glowing in the dark in there. And they come in but you have to be safe, and I totally understand it. But again, we talked about it last time we were here. I hated ringing that bell because I knew what it was like to take all that stuff on, or put all that stuff on, take it all back off.
Yes.
For what, all of a 15 to 20 second visit to hit a button. And it's a lot of waste on the hospital. You just have to keep buying all that, and you got to throw it away. There's no way of cleaning it. It just has to be disposed of. So, you know, there have been a lot of adjustments made, you know, and all this going on at the same time the hospital is making this change. All this expansion work, you know, couldn't have picked a better time, right?
You know, again, you go back to 2018 strategic planning goals, and you know, the COVID was not in that plan, and so
it was in nobody's plan,
and it has affected greatly. And you'll see again today with, as we described at the board meeting, the operations for November was horrible. And so you start looking at those things, and yes, we do have dollars from that CARES Act funding still available. Sure. And so there's still some question out there, and I think looking very conservatively, and that's what that's our approach. We definitely would not want to get ourselves into any type of issue where we owe dollars back to the federal government that we could not pay back. And so we don't want to do that either, but we want to realistically start using some of those funds. And so we will start that process. But again, it's the operations for the last 2 months have been very, for the whole year, fiscal year, starting in July, has been down. And so
it's been rough.
Yeah, it's not something that we planned for or that we thought would continue on through the fall, and those things are unknown. And really, with how the volumes are down, and again, when we start looking at this and admissions and outpatient registrations, the numbers don't look bad. Again, the number of outpatient registrations are very, very close, right on budget. And then year to date, those outpatient registrations are higher than where we were last year at this time, and that was pre-COVID.
Right.
That you kind of just say, how does that make sense? However, the testing and all of the procedures that go with those registrations are down. So the only explanation is that yes, we're getting lots of tests and we're having lots of things ordered,
That's right.
but it's one or it's very few tests per registration. When you start looking at those things, it is very very different than last year.
Especially if you're addressing one thing, you don't maybe do that many tests. You don't get an X-ray for this. You take one lab test, and if you're looking for something specific, it's not even a full lipid profile. It's just maybe one thing.
Yes.
So you don't have the full lab work done, and yeah, it can be misleading at the same time. But we also know that, and we were listening to Doug talk, about the balance sheet and the income statement, obviously. But a lot of people need to realize that a lot of the cash flow that's been affecting the hospital has been going to the expansion.
Yes.
So a lot of people look at the operation. That's the operations, right? It's not looking pretty, and we knew that wasn't going to look pretty. As long as you got COVID going on, it's not going to look good because of the amount of people you got to have coming in and out. You've got the testing to do. You've got a whole different situation at the hospital. You don't have the visitors you used to do. You got to have more people. If you got an acute care center and you've got 8 COVID patients in there, there's going to be a lot more on-hands work done at that time because each of these people have to come in and out of the rooms, got to get, as we mentioned, take all that garb off, put all that garb on, paperwork that's involved, making sure you follow the doctors around. It doesn't get easier.
Right.
It gets harder. It's just like our teachers. And I salute our teachers trying to do this extra work.
Oh, yeah.
After hours, trying to get to these students. And, it's been a rough first half of the year for them. And so, I don't know what the R80 board's going to do tonight, but I know that they're meeting to discuss this mask implementation plan for the second half of the year to get more people back in school. So we'll find out what happens there. But these teachers are working their full day and then a couple hours afterwards trying to get a lesson plan done. And, some of those teachers have gotten COVID, so that throws them behind. So, anyway, we got a lot to be thankful for, but we got a lot of things that right now we just need to get through them and make it through and then get to the next year, and hopefully we'll have a much better year.
Yes.
Yeah.
Yes.
Anyway, let's go ahead and talk about some of these numbers. Kasey's alluded to a few of those. Inpatient admissions, above budget, right about at the level last year, not too far off that. And then your inpatient census days down a bit because, we all know some people just aren't staying in the hospital very long. And so that hurts. But acute care patients per day, Kasey, is up at 12. We haven't been there in a while.
No.
And, so, when you look at those numbers, they look pretty good.
Sure. And that's evident when you get to the inpatient revenue. I mean, that is inpatient revenue is out, and it is that lack of outpatient. But as you start talking about those outpatients, right at budget, $1,750 is about where we're at.
Right.
17 and $1,750 budgeted. And again, when you look at all of last year, that was kind of right where the average was, $1,750. And so you start looking at that, but again, you take a closer look at the actual procedures, the actual testing that's being done, ancillary testing that's being done in the lab and the radiology, and some of those areas are well below the average. So you just know that even though the registrations are there, the number of procedures that they're having done. Just looking at COVID testing, and I don't have specific numbers for that, but when those patients come over or come in to get that testing, we have to register them. They're getting that COVID test, and that's the only thing they're getting, where they might be getting a flu test or other types of ancillary testing that while they're there. So I think it's just that.
And not to beleaguer anything, but also the month of November tends to have a long holiday, a very long holiday when the Thanksgiving holiday starts. So basically,
Yes.
from that Wednesday all the way to that Sunday, it's like taking 5 days out of
Yes.
your budget.
Yeah.
Because every November I've seen has numbers. Outpatient registrations were down from the previous year, all in that 1 month. Well, that's not the average. That's what you had. I mean, that's just
Yep.
the way it is. And so when you see those tests down a bit for the month, then you understand why. It just depends on when that Thanksgiving falls. And then this year you got the one Monday left afterward. It was just a really weird time. We get that one Monday left in November after Thanksgiving.
Yeah.
So it makes it even a little bit rougher. So kind of tough on the numbers there. But another thing that I heard during the board meeting in long-term care. Now we've had some residents that have passed or are not there anymore.
Yes.
And if I'm not mistaken, I heard that the state of Missouri is not allowing you to put new residents in at this time because of the COVID.
Yes.
So
yes.
you're kind of, yes, there's availabilities. Yes, they will be filled as soon as, I guess, this rampant spread settles down and the state says, yeah, go ahead and put them in there. Right now you're 15. I don't even remember the last time long-term care had just 15.
Oh, I know.
In it at all.
Yeah. No, we're usually 100% occupied. So, and that, we're continuing testing, not testing as often as we have because again we've been went this a little stretch here with no active cases. We still have some employees and we're still testing employees, and so but again, as soon as we can, we will fill those and we will get when it's safe for everyone. I think that's the biggest concern is the safety of our residents and the safety of those residents coming in.
Right. So when you look at the numbers, surgical procedures, we all know they always drop around holidays. That just happens.
Yes.
Always does. Rehab will be the same way. People are with their family. The rehab department's not seeing them. And home health visits are usually about the same. But actually, Kasey, you look at them, we're right at their budget from last year and almost at your average for fiscal
for the
year 21.
Year to date. Yeah. Yep.
So not too far off. ER visits are they have been down. They have been down for a while now.
Yes.
But we have a lot of people leaving against medical advice from the ER, and I know that a lot of people at this time don't know what's going wrong with them, so they come in and they may leave a little bit early because they just don't know.
Yes. Yeah. And again, when you look year to date, its average is right at what it was last year. So, but yeah, we don't like to see that. We would rather take care of those patients, get them where they need to go, and get them the treatment they need.
And I can speak for myself because this happened. I didn't think I needed to be admitted to the hospital when I had my little incident. I'm fine. Leave me alone. I looked white as a ghost, and they said, it just don't look very good. And I said, speak for yourself. I didn't look great. No, but,
Yeah.
I could have walked out of the hospital, and actually I had all the intention of leaving the hospital that night. Did not know what was wrong with me. So after they took the test, I'm sitting there waiting. I'm waiting another hour, and I'm going to get out of here. Had somebody waiting for me outside. You're not going anywhere. So when you find out why, then, okay, I could have still walked out the door, but I probably would no longer be here if I did. Or I'd have to have some major medical problems taken care of. So before you just turn somebody down with the medical advice that they want to give you, you might want to find out exactly what the problems are and what could happen to you if you do go home over a long stretch. Not just tomorrow, but over a long stretch of time. So, again, before you make those rash decisions, it's a lot easier to be treated while you're there than go home, wait another day or two, and then come back.
Yes.
And then
those symptoms are worse.
Right. And then you say, well, I don't know what happened. I was fine the other night when I was here at the hospital. Why'd you leave?
Yeah.
You obviously they saw something. So, all right, very good. But again, keep that in mind for your loved ones. Please remind them, better be safe than sorry. If you're safe, you got another shot at it. If you're sorry, you may not.
That's exactly right.
All right, ambulance runs, pretty much right about your fiscal year average. 184 for the ambulance runs. Patients transported about 130. We haven't seen it about 30% dry runs here over the last 4 or 5 months. But got to still have them. They're still out there just in case.
That is true.
That's all right. So 130 patients were transported back to the hospital, which is right at the fiscal year average.
Yep.
Right there. Okay. Let's take a look at that operating statement. Of course, we all know it's been a tough one, and we've been talking about the inpatient revenue. That's looking pretty good. The outpatient revenue a little bit struggling here in the past month. What I do see though is that one of the things that this operating statement does not reflect is those non-operating funds that you were talking about. So even though there is a loss from operations and a loss currently for the year of 1.2 in operations, Kasey, there's just been no operations in many cases to cover salaries, to cover the intense supply expense. We're going to see that coming up in just a second.
Yes.
And just your gain from operations is harder to do when you have less patients and more people to have to care for the ones you have.
Yes. And that, I mean,
it kind of sums it up, doesn't it?
It does. It does. You have, at least when you're looking at our inpatient, and again, we do have that revenue, and that revenue, those patients affect everything, whether it's ancillary, this, that, whatever. But it is something where those patients, again, you have to have more staff. Those patients are more acutely sick to cover what you have. And then on the outpatient side, things are lighter. And again, it's the balance of employees and expense. We're using more expense, more pharmaceuticals, more supplies.
Obviously. More PPE.
Yes. And you
lot
have
more of that.
You have all of those expenses. And we'll see those as we get to the detail of expense. Supplies are just huge, and in that is really medical supplies and pharmaceuticals. So they're both in there, and so you see that increase, and you just don't have the ancillary services to help cover some of those expenses. And so this is where, when we see this loss month after month, that's where as we get towards the end of the year, we'll start getting a little more detail. What can we recognize from our CARES Act funding? What can we bring to the bottom line? Again, we created that non-operating revenue at the bottom of our sheet our operating statement, so that you can recognize some of that. Now, I'm saying we're in the process of applying for forgiveness for the PPP, $2.3 million. And once that forgiveness is approved, that will hit that non-operating revenue. Again, the bottom line will be then positive. But again, that was cash that was used last fiscal year. So, as far as cash goes, that our operating cash, because again, when we put all these things together, when we get the CARES Act funding, when we got the PPP, we separated everything out. And so as we start looking at our operating funds just from operations, obviously those are decreasing due to the loss in revenue. And so you start looking at those things. We're going to have to start recognizing some of that CARES Act funding so that we can cover those.
Well, as Doug was saying, and 11 to 13% below pre-COVID numbers. Now, this started back in virtually April, because March was still about half and half, We know that somewhere middle of March is when they started coming down with the restrictions. But up until that point, the hospital was doing very good in the last fiscal year. Through February, you had excess of revenues over expenses by a bunch. However, the last 3 months ate into that. Basically, I'm saying April, May, and June, those statements reflected things going the other way simply because of the COVID and nobody really knew what was going on to how it's going to affect anybody. And so, yeah, the PPP came in and that can really help you out in putting those numbers over.
Yeah.
One of the things, though, when you talk about 11 to 13% below your normal operating revenue, if you're making $5 million, that's $500,000 that you're not getting.
Yes.
That's a lot.
Yes.
When somebody said, well, yeah, but the hospital charges this and this and this, they have contractuals. And I know we've talked about contractuals before. They don't go away. They may not be billing as much, but they still have these contractuals. Well, they're not getting that full amount that you think they're getting.
No, between 45 and 50% of what our revenue is actually what is going to hit, go towards that covering those expenses.
Yeah.
So
it's not as it's not as lucrative as you might think, because there are these contractuals up there with insurance companies and different things, Veterans Administration, etc. That this is what they allow. This is it. That's all they get paid, and the rest of it gets written off. And so those contractuals don't allow them to show what the true cost is and what they have, and then add on top of that trying to make some improvements.
Yes.
You didn't really pick a very good time to do that.
No.
But like you said, back in 2018, who would have thunk, right?
Yeah.
And who would have thunk if we got something that would have lasted as long as it has?
Yes.
So, but anyway, I found those numbers, 11 to 13%. And I'm talking 10 when I'm talking 500,000. You talk 15%. All of a sudden you got $750,000.
Yes.
Yeah. That's a lot of moolah to try and recover, and that's after contractual dollars.
Sure.
That's a ton of money that you're not getting. So anyway, let's move on to those expenses. We talked about salaries and wages. We know are up. We already talked about you got to have more people in to do the same amount of work as less people did because of COVID. It gets very, very, and really you have to have other people in there just to, for example, not that these are not necessary jobs, but they weren't before, because nobody had to take your temperature when you walked in the hospital.
Sure.
Nobody had to take your temperature when you walked in a family medical clinic. Nobody had to do this. So those positions just add to this. Not that there's anything wrong with having to do that, but they weren't there. Now you've got to have somebody staff that every day.
Yes.
And so that adds to that expense. And as we mentioned, it doesn't sound like a lot, but you have those. You have when people get ill. You got to have people cover them.
Yes.
Do you pay their salary that they have when they're out? Yes, you do.
Yeah, we do.
And
at a premium.
At a premium. So anyway, so all of a sudden your employee wages, they're going to go higher. The employee benefits will edge up a little bit because of those people who do get sick. So things of that nature. Physicians' contracts have actually stayed pretty level. Now we do know there are some other contractual services that we're doing with accounts receivable and things of that nature.
Yes.
But that hasn't been altered too much. What has been altered is the supplies expense, almost $400,000, when normally we would be at $228,000.
Yeah.
That's a huge increase.
Yeah.
I think enough said.
Yeah. I mean, just with that alone, it's
because everything else is in line.
It's pretty good.
Yeah.
It's in pretty
Everything
good
else
shape.
is in line. But the lab and testing equipment, pharmaceuticals, that's what Doug was explaining. Those increase in expenses just have been, and probably, and a lot of it too, Kasey, and not to, because I don't know this for a fact, but I'm pretty sure I can say this with some level of confidence, is the price of some of these has gone up because they're not available.
Yes. Yep.
So you're paying a premium
Yeah.
to get some of these supplies, just because you can't get them.
Yeah,
Like
and if it's not available through our normal route of getting whatever it is, we have to start looking at alternative routes to get that, and that's where you run into higher prices.
Sure.
You don't have that contract pricing. You don't have that bulk pricing that you would have with your normal suppliers. So, yeah.
Well, we had talked to Linda Milady one time when she was in for her interview about the materials management, and we had talked about this is just when the beginning of COVID was coming on about finding those gloves, finding those gowns, finding this stuff. She said, we have to go. We have other sources. We have a favorite source that we use because they give us better pricing. And then we have to move on. Well, I bet her job's a nightmare trying to find different things because, and I know she's not going to be.
Oh, I know.
She's going to be retiring.
I know.
Probably
we're going to miss that
probably
experience.
You can't.
Yeah.
You can't retire until we say you're no. No, anyway, Liz, she's a wonderful person, but you can understand when you're on the phone or you're online and you're looking everywhere to try and find something, and then when she probably finds something and they go back and check inventory, it may not be much.
Yep, that's exactly right.
It's hard to comprehend until you're actually having to do it.
Yeah, and it's worrisome. I know it's stressful. Yeah. I mean, just like the frontline staff they have additional things that they have to do, and that applies. That puts stress on people. Same thing goes with those support services. Right. I mean, they're trying their hardest to support, and it's stressful trying to decide which way to go, what to do, how to best support those that frontline staff. Right. So
very good. Balance sheet, it's looking good. You've got more fixed assets because you got more fixed assets.
Yeah.
you got a hospital expansion, and you got bigger long-term liabilities too because obviously we borrowed the money to put that on.
Sure.
So that's all pretty much normal right there. So we're going to go on past that, and then of course the cash flow statement reflects all the cash going out. It doesn't just reflect the cash going out for operating expenses. It's everything.
Yes.
So when you have a loss reduction in cash, you should expect that with the constant expansion that we have right now. You have to be paying those contractors. You have to get that stuff done.
Yes.
So $560,000 less cash in, but that's expected right now. That should have been even expected with the expansion from last year. Once you knew the expansion was happening, you were not probably going to have a positive cash flow every month.
No. Yeah.
Not even probably remotely for the next.
No.
Now, after next year, when you've got virtually everything paid off and the expansion is finished, then yes, chance of that is much better.
Yes.
Days cash on hand is still solid, 139. You still have those extra funds there, even though they have not yet been used by the hospital.
Yes.
They are there. And certificates of deposit schedule, may as well just go past that.
Yes.
Got some renewals coming up in March, but it's $2 million. It sits there, just kind of sits there. But like you said, how fast does $2 million go in a hospital? Your PPP showed that.
Yes.
And that
really
was
quick.
No time.
Yeah. No, we had that. At the time when we asked for that amount, it was an 8-week.
Right, 8-week program.
8-week program at the time, and so we asked for that 8 weeks, and again, it was probably didn't take us 8 weeks to spend it. So, when you apply for things like that, you're a little bit more conservative, and you say, we want to make sure that we can spend it in the amount of time that we can.
And you could spend it on a couple of things, but most of yours all went just for salaries.
Yeah.
Just salaries. All right, aging accounts receivable, they were up a little bit. It took 103 days in net AR. Well, they're still working on it, but at this time, this is normal. This time of year, things do slow down.
Well, they do, and I'm just going to say I think that at least the first half of December has been pretty decent too. So I mean, I know they're.
I pay my bill.
You bet.
It's up 25%.
Guido's coming. No, I'm just joking. But I think our business office has done a very good job working with the extended business office and the community, and they've done a pretty good job with the first 15 days of December. So, and when you start looking at cash receipts and what has come from self-pay, after 5 months, we are in very good shape compared to what we had all year last year.
Right.
So,
I would probably need to remind people that on the website at SMDH, you can pay your bill there.
Yes.
You know, I don't know if we really have ever talked about that too much, but you can pay your bill right there with your credit card, and it's easy to do if you want to do that. Yeah, you can mail it in, and that's fine too. But if you want to, you can pay it right then and there. Just go right on where it says "Pay Bill,"
Mm-hmm.
and I was just happened to be looking on the website, and I saw that. I said, "Well, heck, that'll save me 55 cents." So went ahead and paid the bill. Anyway, but kindly remember that when you do get a bill, as long as it's over $100, you get to save 25% if you pay within the first 30 days of getting the bill. So take advantage of that, guys, because our hospital doesn't charge anything like the big city hospitals do, and then you still get 25% off more. That's a pretty good deal. I would highly take advantage if you can. If you can,
Yes.
take advantage of that. So because it's some nice savings. What I did not like is they gave me two bills
Yeah.
for two different things, and one was over 100 and the other wasn't. Thought about adding them up and saying, "You guys figure it out."
Yeah, that'll.
Now, it's not that big a deal, but I saw that. I said, "Really? I've never had two bills sent like that before." But you know, it's two different areas of the hospital.
Yes.
So they sent two different bills. Okay, so anyhow, very good. So accounts receivable. We know how important that is, and we're working on it, and they are working on it. And please do continue to pay your bills. And I think there was something, what I remember hearing about that. Oh, I think it was, you guys are working with the VA right now. There's a couple things there.
Yes.
Yes. Because I remember Judy asked about that. So,
Yes.
because about that.
Yeah, she asked about it. Just because the VA, the CBOC closed down, we still continue to serve the VA, and again with their contract, the Champus and the what else? But anything with VA, we continue to serve and serve the community. Any veterans come in, we can still do that, and at a lot lower contracted rate, just like anything else, just like any other insurance.
Doug did mention
TRICARE,
also on a couple of the long-term collectibles that there was some incorrect billing that they're making correct,
Yes.
and that's taking a long time.
Yes.
You know, so
Yes.
it's one bill at a time. So
Sure, and this goes back to, really, this goes back to 19.
19.
Yeah, goes back to 19.
Wow.
2019, and it is that there were certain people that left at the end of 18 and the beginning of 19, that in our own processes, the people that we put into place deviated from those processes, and that's where we really started to get behind at that point. And then you probably understand, once you get a little bit behind, it snowballs.
such thing as a
Everything
little
else,
bit behind.
everything else snowballs after that.
Yeah.
So
No such thing as a little bit behind when you have. Now, there's a little bit behind if you have nothing coming for the next month.
sure,
Then you can be a little
You
bit
can be
behind.
behind,
If
yeah.
you're a little bit behind going into another whole full month of billing and you're not there yet, you're never going to catch up. You
No.
just can't. You just can't do it. And that puts everybody else behind. And then if there's questions, that puts you even further behind.
and back in 19 is when we started our early 19 is when we started our outsourcing of commercial billing, and
Did you recognize there was a problem?
Sure. But and you know, when you contract with someone for a service like that, you rarely get the concern or the service that people that work for you
Oh, yeah.
would give you, and so you rarely get that level of service. And you know, again, I feel like we outsource that to TrueBridge. TrueBridge has done an acceptable job, not exceptional, but you know, it is what it is, and
Yeah.
and as soon as we can, we're gonna get back to
Bring it in-house again.
getting those resources in house and getting that back into our own hands. And again, I think It's beneficial for the community. It's beneficial, if we can create and bring back jobs, then we want to do that too.
Absolutely. All right, very good.
Have a little bit more control.
A lot more control.
Yeah.
You can actually look over and see this is what's going on day to day. Very good. Acute care staffing by patient acuity. That we've talked about this. We had the Ides of November when it really was skyrocketing.
Shoot, yeah.
And then we had some lower days, but actually the acuity level for the most part was pretty steady all the way through the month of November.
Yes.
A couple skews in there from about the 11th on, kind of went up and topped out at the 15th and then came back down. But we all know that the acute care staffing, you got to have nurses and you got to have people there when people get sick, and so the hospital does that to
Yes.
make sure, with every so many patients, got to have a nurse there, so they make sure that is staffed right. Acuity per day was 32, which is a little above normal
Yes.
for the month of November,
Yes.
but basically it was a 1 week period that kind of put them at 32.
Oh, yeah. Yeah.
1 week period. Otherwise, pretty stable. Debbie did talk about the state surveys. There were no deficiencies that came back on their
Yes.
revisit. And then they had the sleep studies accreditation that came through on December 3rd.
Yes. And really, I think
I almost wanted to say something to me like, what, did they take a nap? Sleep on it to see if it's worked?
no, we did have some probably documentation issues where, I know one of those things is quality. Well, we've got quality checks. Well, it didn't go through the proper channels. Otherwise, we were collecting data and making decisions off of that. It just didn't go to our quality team to make sure they were monitoring it as well. But for that department, it was being done, and it's just the change in reporting there. So not a big deal. Nothing really patient care oriented in the survey. That plan of correction will be due in first week of January. So,
in case of something we were talking here amongst us at the station, I said, I cannot imagine what every different department the hospital has, and the state's going to come in and inspect every single one of them, that every time you turn around, there's another inspection. It's from a different set of people.
yeah.
Yeah. Oh, hey, I'm here to do your sleep studies. Hey, I'm here to do the clinic. Hey, I'm here to do long-term care.
Yes.
When are you going to stop? Because what that does is that just detracts away, takes somebody off their normal job. And here we go talking about extra money. You got to bring somebody else in to cover what somebody else is doing because somebody has to work with these people.
Yes.
And if they're there for 2 days or 3 days and they've got questions, they got to be able to answer them. So there's an additional cost to these people coming in, but it just is amazing. I hadn't really thought about sleep studies having to be accredited, but yeah, I know.
Well,
it has to be.
Yeah, no, and there's different services as you bring different services into the hospital. That service may not just fit under a department already, and it may be managed by a department, but it doesn't just automatically. Is a certified service that gets to report under that. And there are things like this, sleep studies, that is very specific and has to be certified and accredited individually.
Separately, yeah.
And so you have that. And I know that when someone comes out to Salem Hospital or has services from whether it's the hospital itself, long-term care, home health, even the ambulance, even dialysis. When you start looking at those services, a lot of people, yes, we are our one organization, but all of those different pieces have different accrediting or different surveying time frames. So you may get one that's not on here is dialysis, and they walk in Monday at noon and say, hey, we're here to do your dialysis survey. And again, they left yesterday, Wednesday. So, and so when they left, it wasn't a formal exit, but those deficiencies that we had will be put into a final report
Sure.
in the next 10 business days, and we'll get that report, and then we'll have 10 calendar days to turn that around to get them a plan of corrections.
Yeah, sure.
And really, when you look at some, they're always going to find something. And
Sure.
again, with the no deficiencies that we received was a revisit. So you hope that you have no deficiencies during that revisit, because it's just that, it's a revisit. So,
Right.
and usually that what I know the state has changed as far as doing surveys is when they're called in to do a survey, anything that's changed in the regs since the last time they were in, they get to apply and survey for those things.
Yeah.
So it's almost like a whole new survey.
They're
every time they
implementing
come
them,
in.
and you have never
Yeah.
had a chance to do that.
Yeah.
And
So-
they're saying, why haven't you done this?
And so we, that makes us the requirement for us to always be watching the changes in those regulations so that we can apply those and implement those as soon as we have them, because we will be surveyed,
Sure.
and that's just a fact.
Yeah.
And we should be. So
Well, I mean, they got to have some oversight.
Yes,
Right?
yeah.
But I just, when I was thinking about that sleep study, I was just thinking, well, just go in there, take a nap, and you find out everything working good.
yeah.
Would be nice if they did that, right?
Yes.
Yeah, they didn't do that, though. I'm sure they looked around. They asked for a lot. They probably ask a lot of questions. How well do you sleep? Stuff like that.
Yes.
Yeah, there's a
They
lot
can
of,
tell you.
Yeah, they'll tell you. Very good. Okay, well, Ashley Sullins was in, and Ashley has been doing home health now for a while. She got a lot more on her plate than after her last meeting. She had told the board there was going to be a lot of changes made.
Yes.
And so she got a
Yes.
lot more on her plate. So anyway, but she made a presentation from October 2019 through September 2020. And our SMDH hospital is still one of the top home
Yes.
health around.
Yes. Yes.
Maybe even in the state. I would have to almost venture in the state.
Sure. I
We're-
mean,
we're over statewide averages virtually
definitely
everywhere.
over those benchmarks.
Yes.
So, you start looking at some of those main, excuse me, some of those main areas, likelihood to recommend, overall rating of care, and care of patients. You start looking at those, and we are well above those benchmarks. And then when you start looking at patient satisfaction as well, those are high marks as well.
The infection control, you had 1 quarter where you didn't have any.
Yep.
That's pretty impressive. And then, of course, you don't want to have 5 and above percent-wise. And Salem was under that in all the whole year that we just talked about, that whole level of year. But 1 quarter of that, they didn't have any infections. So
Yes.
that's
Yes.
pretty impressive. And then, there's a whole lot more information that she gave this time than she had to last time. And I know
Yeah.
that's part of what her
Yes.
requirement was that she was going to tell. But still, all this paperwork has to be done, has to be filed, you get a survey there too.
Yes. Yes.
And anyway, but she had gone over some Medicare updates that things changed. And, I know, Kasey, I'm looking at this and I have no idea what most of this says. There are some changes for the Missouri waivers were granted through the pandemic. Obviously, we pretty well, that was done virtually everywhere.
Yes.
But an extension of certain billing time frames, and we understand that. However, some of the things that they're talking about with the permits, the physical therapists or occupational therapists
Yes.
to conduct their initial evaluation when a therapy is ordered. A lot of people wouldn't know, when is that? I mean, is it the day the doctor orders it? Is it within a week?
Yes.
Is it within is there a time frame there? And then now the focus on infection control and adverse events is kind of front center. And then the 14-day on-site visit for an aid supervision can be provided now via phone. That is a nice
Yes.
change.
Yes.
Kind of get that done. And the annual on-site supervisory visit no longer is required. Well, that's
Yep.
a nice change,
Yeah.
too. But the clinical record request has been extended to 10 days. Probably with COVID and stuff, that's probably a good idea.
Yes. Yeah. And, you look at those things, our clinic as well, and I know we're in home health, but clinic as well. I mean, I think the federal government has waived some of those requirements. We can actually provide telehealth visits from a clinic, and Medicare did not allow that prior to this,
Right.
and so that was something that changed. And
I think
so
that change is going to be permanent now.
we hope it should be,
Yeah.
but and again, it's not the best way to receive care, but there are times where it may be a good compromise.
Yeah.
You know, I know that everybody's wrestled with that has medications that, hey, I couldn't get in, I can't come, I can't get there. Well, okay, let's do a telemedicine that I'll extend your prescriptions by 2 months, or we'll schedule you to get in a couple of months, and I'll go ahead and write you scripts for the next 2 months. And those are things that I'm sure anybody that's taken medication has, encountered that. So you're right. It has been beneficial.
Okay, so something that I was not aware of is beginning next year, though, there will be some changes, and that is a no wrap payment, and that kind of puts the hospital back a little bit.
I mean, when you start looking at cash flow, that is something that has helped with that cash flow, and when an episode is a 60-day episode, you're not collecting any cash until after that 60 days, and it's it could go to 90 days by the time you get paid for services that you started 90 days ago, and those are again,
or 120 days, depending upon the timing.
Sure.
Yeah.
I mean, it is a cash flow issue, and so.
So when we talk about the wrap payment, though, and people may not understand it, and I didn't understand it, so I was glad that Ashley explained it. You got cash up front.
Yes.
Some cash up front. Not the whole bill, but you got some up front.
On the initial evaluation, it puts you into home health, a group. Okay, so just depending on your the care that you need, it puts you into a certain diagnosis, so to speak, and a certain plan of care. Okay. And so when you're in that specific category, we know that for this 60-day episode, we're going to get, let's just say, $3,000. Well, they would pay us 60% of that up front, even though we haven't completed the service.
And then wait for the final claim.
And then when the final claim comes, we refile, they take back the 60 and they pay us 100. I know that's kind of, but that's the way it works, is they take back that 60 and pay us the 100% of whatever. At the end of it, if the group may change, the reimbursement may change a little bit, and they make sure they square up what reimbursement we really should be getting. And so, again, that's always been since, I'm going to say for the last 15 years, that's been that way. And so as when that change happens, that wrap goes away. We just have to make sure we have enough cash to get us through, and we will, and we'll get through it.
Sure.
But it will be, for a while, it will, until that first group of episodes, or the first, 6 months, 9 months worth of episodes roll by, we will then start, having an easier way to get cash flow and
until you
that
establish a cash flow system.
Yes.
I mean, because you have no cash flow.
Right.
Effective January 2021, you'll have no upfront cash flow. So you'll be living on what you already have submitted, and then you're going to get the final 40% of that, and then initially, and then you're going to.
Of all those things that, of all those extensions we've had of days, it's one of those things that you say, well, and there's lots of regulation that is set, for years, could be years ahead. Hey, this is going to go into effect this date, and nobody saw COVID. Okay,
no, right.
But it's one of those things that they go, hey, we've extended, we've given you a break, we've given you a waiver. How about a waiver on that? Because that would be beneficial. That would be real help because I know everybody's got their criticisms of the federal government and what's been done for COVID, and we definitely all don't agree on all those things, and that's
Sure.
okay. But you start looking at where's the real help. I'm going to tell you today we've got $4.3 million that it's sitting in an account. We haven't used it.
Touched it.
It's not real help. It's sitting there. So we're going to break into that, but
Yeah.
it's just one of those things that you go, well, it's not timely. It's not.
Well, there was a lot of question as to how
yeah.
to use that money, and there still may be.
It is not explained how to use it and what's in a way that makes you feel like you can use
comfortable.
it. Yes. Yes.
So you know exactly how to
right.
account for this?
Right.
Yeah, that might be interesting. And then Ashley brought up some home infusion therapy services benefit. I didn't understand that one totally. Can you just touch on that? Because she brought that up, and I wasn't quite sure what that benefit would be.
Other than I tell you what, I will gather some information because I didn't.
That's fine.
I didn't get
Gotcha.
that. Other than today, they can't provide that infusion if there is something ordered, medication, some type of that allows them to do that actual infusion in the home.
Okay.
Today,
So, but next
has
year,
to be provided in an outpatient service.
next year they can do that.
Yeah.
In the home. Okay, very good. And then the star ratings that Kasey was alluding to earlier. Star rating for the Salem Hospital, right at the very top 5. When you get the patient satisfaction, it doesn't get any higher than 5.
Yes.
And that's higher than some other locations around the area.
Sure.
And it matches others. Then you have the star rating, where Salem is just below the top
Yes.
and much higher than other ones, even in our area very close to us, where the star rating.
Yeah.
Salem is 3.5. The highest you can get's 4, and 3.5 is pretty doggone good. So they're
Yes,
right
very
there.
proud of the services they provide.
Absolutely.
They
We already
do
kind
a
of talked about
fantastic job.
talked about the quarterly infection rate. Got that down, and then she went over the different ones that was there. So very good. But you looked at April, May, June, not a one, not a problem at all. So very good. So I want to thank Ashley for a great presentation. Yeah, she's a jewel for you, and she
Yes.
definitely knows her stuff and makes a very nice presentation actually. So,
Yes.
to the
Yes.
board. All right, Jason Edwards came on. I mean, that's a total difference from Ashley to Jason. Oh, Jason's a great guy. Anyway, Hospital Foundation Advisory Board is going to be meeting in January. They're going to be talking about some different things. Obviously, the golf tournament coming up in June, and also the Wings and Strings that would be in probably September. Dancing with the Salem Stars for January has been canceled. Hasn't totally been canceled forever or anything.
Yeah.
Still like to find a date that they can have it. However, I guess until we get more vaccine in and everybody gets kind of some vaccination.
Yep, and some of the
done.
rates start dropping, and we
Right,
see
yeah.
things. Yeah.
And hopefully we will. People got to remember, even if you get the vaccine, you're not going to see any difference for another month.
Right.
Because anybody who already has it, they're already in the system, and whatever happens to them is going to happen.
Yeah.
We don't want anything to happen to them, but hopefully it won't, and nothing will. Hopefully they'll get healthy and come back. The USDA Distance Learning and Telemedicine Program grant, the TytoCare Clinic demo, you already got that in. You guys have been working with the different schools and stuff, and now it's just going to be a matter of being able to provide hands-on demonstrations.
Yep. And really in-house, we started the in-house process to just, again, set up the equipment. And just like anything, telemedicine depends on your bandwidth or what kind of internet connection you have. And so when we test it in-house, it doesn't really give us a realistic delay. The delay might not be there because, again, we're all on the same network.
Right.
And so we've started doing that. The next thing is to roll it out to one of the rural schools, just to see.
Test it.
Yeah, just to test that and see that. And we probably won't roll it out in an active status, but it will go just as testing.
Sure.
We're just testing the connections.
Yeah, and then the faster the bandwidth, the better that will be. And
Yes.
we know some of those areas, bandwidth is a challenge sometimes.
Yes.
But you can get some
Yes.
hot spots and hopefully get it up there to where it needs to be. All right, the COVID-19 update, no visitor policy continues. You got all that disinfecting equipment last time. We got that in that report last time. You gave us a whole list of stuff, the good sprayers and the guns and all this
Yes.
stuff. Yeah.
That came in.
And then you updated them on the Show Me Vax, which we already kind of talked about.
Yes.
You got approval to
Yes.
do the Moderna?
It will be Moderna. That will be the vaccine we use. Of course, as we discussed, that approval will come probably tomorrow. But we are planning to use that.
Right, and you're working with the Dent County Health Center on these vaccines.
Yes, and we are both, early on, Kendra and we have been planning and talking about that, and we both felt like we needed to be providers of that. And so even though as a community, I know we can work together and pull that off. But again, I think we're waiting for the fact sheet for Moderna to come out to say, okay, exactly how are we going to roll this out, and making sure that everybody understands, the indications of this of this vaccination, to make sure it's safely given. Monitored, there's a certain amount of time that has to be monitored after we give the vaccination. We want to make sure that whatever process we put into place, if we wanted to do maybe a community, a community-wide vaccination, that that we have all of those plans, the way maybe we roll it out. Again, we want to make sure that those that are the highest risk get that first. Right. And so we will be looking at the employees of the hospital, I'm sure, and any really healthcare providers will be looking at those and then going from there.
Right, your residential care is out and about.
Yes, yes, and yeah, that's our long-term care. I mean, that's part of our hospital. I mean, that's again, they have their own provider number, and it's a little bit blurry there, but all long-term care nursing home facilities the state is requiring them to receive their vaccines a specific way, and so it's not included in our vaccination at the hospital. So,
but these are the people getting the vaccine first.
Yes.
And so be looking, just stay informed, because it'll take a while.
And as we gather information, and that information is available, we will post that on our website. We'll post that on Facebook. We'll put that information out there, or a link to that information. Yeah. So. We will do that.
Yeah, maybe a lot of information, and of course there'll be more information as more of the vaccines are being used, as to any adverse effects and things of that nature. Just like any other vaccine, I remember years ago the flu vaccine, when people had an egg allergy, and of course it was made out of eggs. Yep. And I can't take it because I have an egg allergy. Well, give them time, and they finally found one that didn't have eggs.
Yes.
But until they find out about them.
Yes.
Or what people can't accept, their bodies just won't accept that, or has a reaction to it. So I'm sure there'll be some.
Sure.
I mean, there will be some, but hopefully not many. And let's keep everybody going. All right, let's go to the hospital expansion and renovation update. Getting closer all the time. The MRIs. We're doing appointments now.
Yes. We're seeing our own patients. I know that we've had some backups. So Alliance Imaging has not. I mean, they come in and out all of the time, and so they will continue to do that. I believe through January they will continue to be on site. But otherwise, we are seeing those patients in our own MRI and scheduling them and giving those exams and those procedures
Very good.
are happening in our own. So
That's
if you need
exciting
that,
news.
if you need that, call the hospital scheduling and or have your doctor's office call and schedule your appointment there, because
Yeah.
you can get that. It is a large bore MRI. It's not like it's not as small as the imaging that we've had out there so
Right.
far, or with Alliance Imaging. It is a big new machine, and so it is excellent. Images are fantastic. We just had the inspector from came through with flying colors, was fantastic. So we're ready to get to it.
Everything's ready to go. And the new outpatient registration is now open. Yay.
Yes. Yeah.
Yay.
Yeah. I mean, you get. We had a kind of an temporary outpatient registration area, and that has now moved to the permanent area. Brand new area. It is nice, very nice. Had many compliments already. But really, it allows us to a general outpatient area away from that ER registration and that ER waiting room, where you could come in, register, and wait for that service to be able to get that service right there. And
Right.
so, yeah, it's going to be nice. And it may not with new areas like this, the process that we has to change as well. And so we will be working on those processes and trying to get those times down of how long you wait for those services. So
Takes a little time. Got to work all the bugs out.
Yeah.
It is there. Sewer project is getting very close to being done now, and that includes the administration hallway, and you're very close to being
yes. Still
there.
some
Are
small
you
things.
already done?
Well,
Did
some
you-
small things. They're still working in the
Okay.
area with some electrical work and but I would say
But the sewer work is
the end of this
actually-
week, beginning of next week. It's the actual
sewer
sewer
work
stuff
is done.
is.
But this is all
done.
associated with that.
Yes.
Okay.
With the expansion,
Yeah.
everything.
Right.
So all of that getting put back into place and should be. I'm thinking Monday. I know that because we had that hallway shut down, we had a temporary meeting room and a temporary presentation room and all of those things. I think next week those things will all get put back together. IT will be putting all the computers and stuff back to where they were. We had moved kind of a technical classroom that we had. We had moved that, and we're going to put all that back. And so next week I think we'll be working on that.
Back to normal?
Back to as
Near normal.
Yes.
Near normal. Okay,
Near normal.
very good. Yeah, well, no, nothing's back to normal right now at this time. Anyway, and also easement approval for your electric and generator.
Yes.
For your backup.
Yes, we worked with Seville to dig across the road there, and that is their property, and we just needed to arrange that, and that has all been accepted and signed, and we are starting probably to dig outside today. So
Good day to do it, man. It's cold, and what else you
Yeah.
gonna do on a day like today? Ugly. Hopefully the sun will come out
But
this afternoon.
that road to Seville will not be shut down
Right.
at any time. We were going to do it in
Pieces.
and we'll be everybody coming in and out of Seville or getting through the hospital. You shouldn't have any problems.
All right. Very good. For the bonds, the board did
Yes.
pass approval of, if needs be, using the property tax that is collected to pay the bonds for the construction work on the hospital. Again,
Sure.
does not go for employee salaries.
Yes.
And this is one of the keys. It's always gone for equipment. Well, this is also can be used as an asset
Property,
expansion.
plant, property, plant, and equipment. And so it has, I will say, back in June, May or June, we approved, I think it was June, we approved finalized the capital budget and the operating budget. And so as we did that, those things were line itemed in there. The what is owed to the bond this fiscal year was placed in there. However, it didn't specifically say we are dedicating funds out of the taxes to pay for, and they needed that
Assurance.
yeah, and that language to be used, and so we went ahead and did that.
Because taxes are a guarantee,
Yes.
basically,
Yeah.
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 to back
So,
it.
Yes.
Very good. All right, we have election filing going on. It's amazing. It's already that time of year for our municipal
is.
election, but District 2, that position is open. Mike Swires currently holds that one, and he's refiled already.
He has.
That's
He has.
amazing.
He was in early on the 15th. So, yeah.
Got till January 19th at 4 o'clock, and you can just go do that at the administration office at the hospital.
And if you have any questions what District 2 is, please come and see us. We can show you a picture, and we can see exactly what district you fit into. So,
More than likely, there are questions where a District 2. I mean, it's just, where are the lines?
yes.
Yeah.
Yes.
Where are the lines? All right, we had some purchases. One is for a hemodialysis machine. As we talked about a dialysis being inspected, we're replacing those machines. I go one by one by one by
Yes.
one.
Yep.
And this is a replacement from Fresenius for $15,000.
Yeah.
And this is the one that the people want to get. This replaces very one almost similar to this one, right? Virtually identical.
Oh, yeah. Yeah.
Yeah. Okay.
Just a newer version of that machine.
All right, very good. A little bit over budget, but that budget that
About
was
$500 over budget.
Yeah, but you know what? That budget was found out probably back in March of last year.
Oh, yeah. Yep.
Times have changed, so has the cost. All right, this is a big dollar figure. I always like
Sure.
the servers and your storage from Paragon. Hospital has a lot of computers.
Oh, yeah.
They have a lot of need for storage, and they have a lot of cabling. You've got so many different things going on with their computers. These are some heavy duty, what you call your heavy duty computers here.
Yes.
Now you're talking about some big dogs. They're not going to be cheap. I don't care where you get them. They're not going to be cheap. You're looking at $75,000. That's a lot of money.
Yes. Yep. And it was over budget. We had budgeted 60,000, so it was a good 15,000 over budget. Which
You can't get computers now. You can't get them.
yeah.
I mean, the parts for them coming from overseas, they've increased the price of those if you can get them.
Yeah.
And then to build a computer, well,
Yeah.
so it's kind of crazy. But yeah, 75,000, and that's been what, those computers you have now, about what, 10, 12 years old?
8.
8 years old.
8 years old.
It's
Yes.
a long time.
Yes, it
And
is.
times, and with technology, 8 is like 80.
I know. if you go over, seriously, anything over 5 years, that's great.
Yeah.
But
But it needed to be done before
It
there
did.
was a problem.
it did.
Okay, and the Neon Codon sensors. What is a Neon Codon sensor?
Well, the Neon Codon is the vendor that we use for our telemetry services.
Okay.
Okay, and
The
so
little things you stick on your
little-
chest.
yes, but also the monitoring systems in each room is through that same
Okay.
company, Neon Codon. And so these things that we purchased were the CO2 sensors within the system, and so we just needed to replace those in our as we start looking at replacing the whole telemetry, which is technically in this year's budget. As we look at replacing the whole thing, we needed to replace these sooner than the rest of it. But what will happen is we made sure that these things that we replace it with, when we replace the whole thing, will be compatible with the new.
That would be good.
Yes. So we made sure that that's happening. But and so these particular items were non-budgeted, even though the whole system is
Budgeted.
when you replace a system like that, that is a capital budget, or that's a capital. It's a capital item, but it's also a capital lease that will go into place. So we budgeted a year's worth of a new capital lease to replace those. And really, if we get, like I said, over 5 years, if we get over 5 years with something like that, we will have gotten our
You got your money's worth.
Yeah.
Yep,
Yeah.
absolutely. Okay, very good.
Yeah.
Going to closed session, any decisions?
Yes, we did. We had been reviewing details of a contract with Cerner.
Cerner.
They are an electronic health records vendor.
Spell Cerner if you would.
CERNER.
Okay, CER. Okay.
Yeah.
Okay.
And they are one of the probably top, I'm going to say Epic. Everybody's probably heard Epic, EHR. Cerner's probably your next, I guess, widely known EHR. And so we have been looking, we had talked about 2018, our strategic planning goals, and that was one thing, is to combine all of our EHRs into one EHR. Now, this is not a purchase of hardware. It's not a purchase at all. It is a service. We will have software as a service, and that is what we've done is do that. And now the next step is to start planning that implementation. And we're not talking about tomorrow. This will hopefully be over the next 12 to 15 months process. So prior to even starting to come on site or to plan that with us, there will be a lot of planning in-house that we will be doing to prepare our system. Again, I don't think there's no plan to take anything out of our old system and put it into the new system. So there will be additional costs to take our old systems and archive those so the data is still available to us. And so all of those costs were discussed and really prepared for. There are costs with our current systems that were coming up mid to late 2022, okay? And so this decision was made so that planning, we knew the implementation, it's not immediate.
Right.
And so we need to plan to have this implementation done by mid to late 2022. And it's possible. It's very possible.
Those renewals will be coming up. You don't want to renew them.
No. We have bigger expenses. We talk about servers. We've got hardware included in our current purchase of software and how we maintain that. And we have other servers going out of commission probably in mid 2022, and so to prepare to not have to pay those expenses, we have to implement prior to that. And
Get
so
started early.
yes,
Yeah.
yes, and we need to start now. And so and the good thing is those any contract pricing that we've agreed to will not be put into place until we go live. So even though they're helping us and preparing us, and we're taking room up on their servers to get our template or our system created,
Right.
we won't have any additional expense for software until we go live.
Wow.
Which is a good thing. So.
So you just agree for the services through a contract?
Yes.
And they'll get started, and
Yes.
there's no charge.
Yes.
Okay.
Yes.
Well, that's good stuff.
Yeah.
I like that.
No, you know what? We've been needing, I'm going to say our 3 EHRs, electronic health records. We have 3 different systems on the hospital campus, okay? One is all scripts in the clinic, and that's what, when you come in and you have a clinic visit, that's what they document in.
Right.
We have one CPSI or Evident in the hospital, but then we also have one specifically to our emergency room documentation. It's all a little bit different. And so today, the only information that goes back and forth with them is orders and results. Okay? MedHost will put into, and MedHost is the ER system, they will put a final document into the electronic health record and Evident, which is our permanent health record. But other than that, it's no more information is shared. So if you're over getting hospital services inpatient-wise, to access what they do in your clinic, they have to go exit out of the system they're in, go into a whole nother system to,
Wow.
yeah. And so all of these things will be brought together with Cerner.
Okay.
So-
Well, very good. Well, that was something that I know you were working on back in your days as assistant.
Well, yeah.
And you're trying to get
yes.
all that done.
Yes.
That was a headache. That's why you lost all your hair.
That's why it's
Kept
gone.
pulling it out.
Yes, exactly right.
Dealing with
And if not,
CPS.
COVID would have driven it.
Yeah,
No.
I'm sure. Sure. Anyway, I want to thank Kasey for coming in. Our hospital administrator does a tremendous job. Our hospital staff does a tremendous job. And
They do.
remember, these people during this COVID, they're there, and it doesn't matter. They are there to treat you and take care of you. So tip your cap to them. It's not an easy time to be a healthcare professional. I can tell you that much.
No, and you can, I tell people every day, and we have a morning briefing every day, and you feel like you want to say every day, thanks for everything. And, after the 10th day, it's trying for everyone. Everyone is stressed. There is just, imagine having every patient or the bulk of patients coming in and you're questioning, is there something, is COVID present with this patient? What should I do? And always having to be on your toes and thinking proactively, what do I do to protect myself?
Yeah,
So,
and not only yourself, but all those around you.
yes.
Very good. Thank you for coming in. Kasey Lucas, our hospital administrator.
Thanks, Dan.